This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Momton HT Cream is an effective treatment for managing dark spots on the skin caused by melasma. Indications and uses. This cream is primarily used for adults to manage moderate to severe melasma, which manifests as symmetrical brown patches on sun-exposed areas of the skin, especially the face. It is essential to incorporate sun protection measures, such as sunscreen and protective clothing, to enhance treatment efficacy. How it works. The cream works by combining hydroquinone to inhibit melanin production, tretinoin to rejuvenate and repair sun-damaged skin, and mometasone furoate to alleviate inflammation. Directions for use. To use the cream effectively, apply it as directed by your physician. It is intended for external use only. Begin by washing your hands before and after application. Cleanse your face using a mild soap and pat dry thoroughly. Apply the cream at night, massaging gently into the skin until absorbed. Avoid contact with sensitive areas such as the eyes, nose, and mouth, and limit sun exposure during treatment. Possible side effects. Common side effects may include mild burning, stinging, redness, and dryness of the skin. If any symptoms worsen or persist, it is advisable to consult a healthcare professional. Precautions and warnings. Before using the cream, inform your healthcare provider about any pre-existing health conditions, especially liver, kidney, lung, or heart diseases. Caution should be exercised in pregnant or breastfeeding women, and it is contraindicated for individuals with known allergies to any of its components. FAQs. 1. What is this cream used for? It is used to manage moderate to severe melasma in adults. 2. How should it be applied? Apply as advised by a physician, typically at night after cleansing the skin. 3. Can it be used on wounds? It is not recommended for use on wounds or ulcerated skin. 4. What precautions should be taken? Reduce sun exposure and wear protective clothing when outdoors. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. We appreciate your engagement.